before understanding arthritis, we should know what is the normal knee. So our normal knee is like this. There is an upper bone and a lower bone. And we have smooth cartilage here. See here, there is smooth cartilage on both sides. So when there is smooth surface on either side, you get smooth movement. Okay. With age, what happens, like any surface, this cartilage becomes slightly less smooth. It becomes rough. And when it becomes rough, you get friction. And with friction, you get pain. So this is arthritis, osteoarthritis. There are other types of arthritis also, like rheumatoid arthritis, seronegative arthritis. But osteoarthritis is the most common, which is the old age arthritis, which everyone will get at some point. You can only slow it down. Conditions which can aggravate osteoarthritis are extreme obesity, or if you are indulging in impact exercise like lot of jogging, lot of running, and twisting injuries. So that is basically arthritis. So previous to this, patients used to carry on with the knee pain in arthritis. But since the last 20 years, the treatment of arthritis has been revolutionized. So now we have knee replacement surgery, also known as total knee replacement. So let's understand what is total knee replacement. So what we do is, this bad knee, which is arthritis, the surface, we take it out. So once we take it out, you have something like this. We take out the bad area on the femur, the upper bone, and we take out the rough area on the tibia, which is the lower bone, and onto that we fix this cap, which is a special titanium chromium cap, and similarly we put another cap on the lower bone with a plastic, and this articulates perfectly with the upper bone. It is designed to articulate perfectly with the upper bone, and when it does that, you get perfect movement. And since the surfaces are very smooth, you get good movement. You can even squat and sit cross-legged. So that is the beauty of knee replacement surgery. And most important part about knee replacement surgery is you become painless and you regain the freedom of your life. So that is how it has revolutionized treatment of knee arthritis. So robotics, as technology advances, like in iPhone, now you have iPhone 15. We no longer use the iPhone 6. Similarly, in knee replacement surgery, you get all these advancements over the years. So in the last 2-3 years, robotics has made a huge impact in the outcomes of knee replacement surgery. So the optimum outcome of knee replacement surgery depends on 3 things. One is a good implant, which is high flex implant. Use only the imported implants, high flex implants, and proper cuts and meticulous closure with a small incision, minimal invasive surgery, that is MIS. So these 3 are the pillars of knee replacement surgery to get an optimum outcome. Now already we were doing MIS, that is a small incision knee replacement surgery, and we were always using the high flex imported implants. So what has changed is the robotics has improved the cuts. The cuts are really precise and very minimal, and hence the post-op pain is much less. So the robotic is basically to take the good cuts, optimum cuts, precise cuts, so that you get the best knee replacement surgery outcome. Yeah, as I said, normal TKR surgery, the surgeon takes the cut, but in robotic, it is in consultation with the robot, the computer behind the robot, and we guide the robotic arm to get the proper cuts. We don't use the saw, we use mainly the burr. It is like 3D sculpting. So that entire plan is designed on the computer screen and we implement that plan. So the main advantage is, since the cuts are precise, the implant will last longer, more than 35-40 years. And since it is precise and in good alignment, the post-op pain is lesser and the post-op movement is also better. So all in all, it just exponentially improves your knee replacement surgery. So there is only one disadvantage which I find, because we have done so many robotics now. The only disadvantage, if you are untrained, then you better call a trained robotic surgeon like us who can help you out with the knee replacement using robotics. Because if you are not trained, then the surgical time becomes almost double or triple, and then the patient can land up with other problems because of the increased surgical time. But if you are really trained, in fact, robotic knee surgery is faster and better with precise cuts. So this patient is a 65-year-old female, and she has been suffering for many years, almost 15 years, with bad knee pain. And she has tried every treatment in the book: allopathy, homeopathy, Ayurvedic, massage, everything. And she has been delaying this particular knee replacement surgery because she wanted someone to assure her that she will get the best outcome. And since we are doing robotics, she was easily convinced, and post-op she has done extremely well, and now she is walking without support. Patient had bad knee arthritis, and when you have carrying on with the bad knee arthritis for many years, what happens is the knee becomes really crooked. It doesn't remain straight like this, it becomes really crooked, and the deformity is really bad. If you try to do conventional knee replacement surgery, you might land up with a problem with malalignment, and that can lead to pain and stiffness. So robotics scores over conventional knee replacement in that regard, in which we take precise cuts, and when the deformity is especially very bad, it becomes easier to correct with robotics. And you can see the patient walking very comfortably on the very second day. That is the magic of robotic knee surgery. See, compared to conventional knee replacement surgery, this is much faster. The patient walks on the very second day with walker, and within a week's time, we can expect the patient to discard the walker and shift to a stick. And maybe the stick might continue for a week or so, and then the patient can walk unassisted. Also, in about 3 to 4 weeks time, I expect this patient to sit cross-legged properly. Age limit is obvious. There is no upper age limit. We have done surgeries for even 80, 85, 90 patients. But the lower age limit, we generally refrain from doing knee replacement surgery under 50, unless there is a pressing need that the patient is really disabled. And even in those patients, we try to get away with a unicompartmental, that is partial knee replacement surgery. Yes, there is a big difference, because the female patients are generally osteoporotic and their bones are smaller. So you have to take that into account. And also the muscle strength is not as good as the male patients. There is a general observation which we have. And so we have to take that into account while taking the cuts and taking the muscle incisions. Knee which is really bad, arthritic, even a conventional knee replacement surgery will give a good result. But if you want a really, really very good result, then robotics is the way forward. Today we are going to operate on a bad knee which is having end stage knee arthritis. This is the X-ray of this patient, which is showing gross reduction in the space with irregular cartilage. And the patient is in so much pain that patient cannot even stand or walk. We are going to operate on this patient, and we'll go through the steps one by one. So this is the heart of the robot. This is the latest Cori robot, which is having a screen, and on this all the readings are seen. This is the heart of the robot. Conventionally, knee replacement surgery has been an open surgery with jigs and with instruments which go into the canal. And this has some issues like imprecise cuts and stiffness and pain post-op. Vis-a-vis, what we are doing is a robotic knee replacement surgery in which the cuts are super precise and there is no need to enter the medullary canal. Hence, there are two main advantages. Since the cuts are precise, the pain is very less post-op and the implant can last for the entire life. And also the rehab and mobilization is faster. So these are two main advantages of robotic knee replacement which help in the patient satisfaction. Okay, before we start taking the actual cuts, we need to know the anatomical landmarks. So this process is known as calibration, where the bony landmarks are registered on the robot with the infrared sensors. And this is how we calibrate. And the robot recognizes the exact location of the bony landmarks, and then the cuts become very precise. And what I am holding is the arm of the robot, which helps in cutting the bone. And since these two are connected, we get a precise cut and results are fantastic. So to conclude, to get a perfect result with robotic knee replacement surgery, you have to satisfy three main points. One is you have to use the latest robot like we have used, the next generation robot. You have to use the best high flex robotic knee implant which is compatible with that robot, and also you have to plan in a perfect manner so that you get a very great outcome, like in this case. Okay, this surgery went off as per the plan to the T. We could get everything which we wanted. We put the best possible implant, and with robotic we could get the excellent precise cuts. And I'm sure this patient will do very well. We'll be starting the rehab from the very second day. Patient is quite comfortable. Yes, every patient post knee replacement surgery definitely requires physiotherapy. In conventional physiotherapy, knee replacement surgery, you require physiotherapy for a longer period. While here, because the cuts are smaller and precise, and also we don't dissect that much, the rehab is much shorter. That is my experience with the robotic, because we have been doing it for the last 6-7 months, and the rehab is really shorter. Today we generally try to avoid walking, because today we just do bedside exercises like ankle movements and few knee movements. But the actual walking with the supervision of the physiotherapist will be from tomorrow. Tomorrow she'll be using the walker to walk, and maybe I think in a week's time she'll be able to go beyond the walker to a stick. She'll be able to leave the walker. This we have put the best implant, which is the HyFlex implant, and all my patients who have undergone a HyFlex knee replacement surgery are able to sit cross-legged. They can squat also. They can climb stairs. They have gone to all international trips, and they have sent me so many thank you greetings and messages. So this patient will be no different. She'll do extremely well. So great. So we talked about the surgery yesterday, and today it is now 24 hours post knee replacement surgery. The patient is doing very, very well, beyond our expectations. She's a really cooperative patient, and the physiotherapist also has done a wonderful job. Patient has walked very comfortably, and I expect her to make a fantastic recovery. This is the post-op X-ray of this patient. You can see the implant is sitting very well, and the cuts are so good that the patient has started walking also today.